Chronic gallbladder disease is a condition characterized by inflammation and dysfunction of the gallbladder, a small organ located beneath the liver. This condition can cause a range of symptoms that can significantly impact an individual's quality of life. Understanding the common symptoms and causes of chronic gallbladder disease is crucial in identifying the appropriate medications for effective management. The most common symptom of chronic gallbladder disease is recurring pain in the upper right abdomen, known as biliary colic. This pain can be severe and sharp, often radiating to the back or right shoulder. Other symptoms include nausea, vomiting, bloating, indigestion, and fatty food intolerance. In some cases, individuals may also experience yellowing of the skin and eyes, known as jaundice, which indicates a more severe form of gallbladder disease. There are several factors that can contribute to the development of chronic gallbladder disease. The most common cause is the formation of gallstones, which are hardened deposits that can block the bile ducts and cause inflammation. Other causes include gallbladder sludge, a thickened bile that can also obstruct the ducts, and gallbladder polyps, which are abnormal growths within the gallbladder. Certain risk factors, such as obesity, a high-fat diet, rapid weight loss, and a family history of gallbladder disease, can also increase the likelihood of developing this condition. Managing chronic gallbladder disease requires a comprehensive approach that addresses both the symptoms and the underlying causes. While surgical removal of the gallbladder, known as a cholecystectomy, is a common treatment option, medications can also play a significant role in symptom relief and preventing disease progression. Let's explore the top 5 medications that have shown effectiveness in managing chronic gallbladder disease. Overview of medications for gallbladder disease. When it comes to treating chronic gallbladder disease, medications can help alleviate symptoms, dissolve gallstones, and improve the overall function of the gallbladder. These medications work by targeting different aspects of the disease process, providing relief and promoting better gallbladder health. It's important to note that the use of medications for gallbladder disease should be discussed with a healthcare professional and tailored to each individual's specific needs. The following medications have shown promising results in managing chronic gallbladder disease and can be considered as part of a comprehensive treatment plan. Medication 1. Ursodeoxycholic acid, UDCA. Ursodeoxycholic acid, also known as UDCA, is a bile acid that has been extensively used in the treatment of chronic gallbladder disease. It works by reducing the cholesterol content in bile, which helps dissolve gallstones and prevents their formation. UDCA also has anti-inflammatory properties, which can help alleviate the pain and inflammation associated with gallbladder disease. Clinical studies have shown that UDCA is effective in both symptomatic and asymptomatic gallstone disease. It has been found to dissolve small cholesterol gallstones in up to 50% of cases, resulting in improved symptoms and reduced need for surgical intervention. UDCA is usually taken orally in the form of capsules or tablets and is generally well tolerated, with minimal side effects. While UDCA can be an effective medication for managing chronic gallbladder disease, it may not be suitable for everyone. Individuals with certain medical conditions, such as liver disease or bile duct obstruction, may need to avoid or use UDCA with caution. It's important to consult with a healthcare professional to determine the appropriate dosage and duration of treatment. Medication 2. Cholestyramine. Cholestyramine is a medication commonly used to lower cholesterol levels in individuals with high cholesterol. However, it can also be beneficial for individuals with chronic gallbladder disease. Cholestyramine works by binding to bile acids in the intestine, preventing their reabsorption and promoting their elimination from the body. This helps reduce the cholesterol content in bile, preventing the formation of gallstones and relieving symptoms. Studies have shown that cholestyramine can be effective in managing biliary colic and improving overall gallbladder function. It has been found to reduce the frequency and severity of pain episodes, as well as improve digestive symptoms such as bloating and indigestion. Cholestyramine is taken orally in the form of powder or granules, mixed with water or other liquids. It is generally well tolerated, although some individuals may experience gastrointestinal side effects such as constipation or diarrhea. As with any medication, it's important to follow the prescribed dosage and consult with a healthcare professional before starting cholestyramine. Individuals with certain medical conditions, such as bowel obstruction or triglyceride levels above a certain threshold, may need to avoid or use cholestyramine with caution. Medication 3. Chenodeoxycholic acid, CDCA. Chenodeoxycholic acid, also known as CDCA, is a bile acid that can be used in the treatment of chronic gallbladder disease. Similar to UDCA, CDCA works by reducing the cholesterol content in bile and promoting the dissolution of gallstones. It also has anti-inflammatory properties, which can help alleviate pain and inflammation associated with gallbladder disease. Clinical studies have shown that CDCA can be effective in dissolving gallstones and improving symptoms in individuals with chronic gallbladder disease. It has been found to have similar efficacy to UDCA and is generally well tolerated. CDCA is usually taken orally in the form of capsules or tablets and is prescribed under the guidance of a healthcare professional. It's important to note that CDCA is not suitable for everyone and should be used with caution in individuals with certain medical conditions, such as liver disease or bile duct obstruction. As with any medication, it's important to consult with a healthcare professional to determine the appropriate dosage and duration of treatment. Medication 4. Simvastatin. Simvastatin is a medication commonly used to lower cholesterol levels in individuals with high cholesterol. However, it can also be beneficial for individuals with chronic gallbladder disease. Simvastatin works by inhibiting the production of cholesterol in the liver, which helps reduce the cholesterol content in bile and prevent the formation of gallstones. Clinical studies have shown that simvastatin can improve gallbladder function and alleviate symptoms in individuals with chronic gallbladder disease. It has been found to reduce the frequency and severity of biliary colic episodes, as well as improve digestive symptoms such as bloating and indigestion. Simvastatin is usually taken orally in the form of tablets and is generally well tolerated, with minimal side effects. As with any medication, it's important to follow the prescribed dosage and consult with a healthcare professional before starting simvastatin. Individuals with certain medical conditions, such as liver disease or a history of muscle-related side effects with statin medications, may need to avoid or use simvastatin with caution. Medication 5. Octreotide. Octreotide is a medication that can be used in the management of chronic gallbladder disease, particularly in individuals with gallbladder polyps or severe symptoms that are not adequately controlled with other medications. Octreotide works by inhibiting the secretion of certain hormones, including those that stimulate gallbladder contraction and the production of bile. Clinical studies have shown that octreotide can reduce gallbladder contractility and alleviate symptoms in individuals with chronic gallbladder disease. It has been found to reduce the frequency and severity of pain episodes, as well as improve digestive symptoms such as nausea and vomiting. Octreotide is usually administered by injection under the guidance of a healthcare professional. It's important to note that octreotide is typically reserved for individuals with specific indications and should only be used under the supervision of a healthcare professional. It may not be suitable for everyone and can have certain side effects, such as gastrointestinal disturbances and changes in blood sugar levels. Other treatment options for chronic gallbladder disease. In addition to medications, there are other treatment options that can be considered for managing chronic gallbladder disease. These include lifestyle modifications, such as adopting a low-fat diet and maintaining a healthy weight, as well as alternative therapies like herbal supplements and acupuncture. Surgical removal of the gallbladder, known as a cholecystectomy, may also be recommended in certain cases, especially if symptoms are severe or complications arise. It's important to discuss these treatment options with a healthcare professional to determine the most appropriate course of action based on individual needs and preferences. A comprehensive approach that combines medication, lifestyle modifications, and other therapies can provide the best outcomes in managing chronic gallbladder disease. Conclusion and final thoughts on gallbladder medications. Living with chronic gallbladder disease can be challenging, but with the right medications, individuals can find relief from symptoms and improve their overall quality of life. From bile acid sequestrants like cholestyramine to cholesterol-lowering medications like simvastatin, there are several options available to target the root cause of gallbladder problems and restore balance. It's important to remember that the use of medications for gallbladder disease should be discussed with a healthcare professional. Each individual's journey with gallbladder disease is unique, and treatment options should be tailored to specific needs and circumstances. By working closely with a healthcare professional, individuals can make informed decisions about their treatment options and take control of their gallbladder health. In conclusion, the top 5 medications for chronic gallbladder disease, including UDCA, cholestyramine, CDCA, simvastatin, and octreotide, have shown effectiveness in managing symptoms and improving overall gallbladder function. These medications, along with lifestyle modifications and other treatment options, can provide individuals with the relief they need to lead a comfortable and fulfilling life. So, don't let chronic gallbladder disease hold you back. Take charge of your health and find the Gallant medications that can restore balance to your gallbladder.